So today we are going to be presenting celiac disease. This presentation is by me, Elizabeth, Yasmin, Caitlin, Angelina, and Aiden. So celiac disease, it's also known as gluten enteropathy or SPRU, but obviously it's more commonly known as celiac. It's an autoimmune disease that causes damage to the small intestine due to ingestion of gluten. So, what gluten is, it's a complex of water insoluble protein, and it is found in foods that contain wheat, barley, rye, anything like that. Um, so, what happens is when people with celiac eat anything with gluten, it triggers an immune response in their small intestine. And over time, like the wear and tear, it damages the villi in our GI tract. And you can see in the picture what a normal small intestine, what the villi will look like and what it will look like in someone with celiac disease. So it just prevents the absorption of nutrients.
So the treatments for celiac disease are to prolong gluten-free diet. There is corticoid steroids that are used to help reduce inflammation. There's also an enzyme therapy for gluten breakdown, to help with gluten breakdown. There's immunosuppressants, and the recommended diet is like fruit, vegetables, lean protein, beans, nuts, dairy, oats, rice, corn, etc.
Other medications that are used to treat celiac disease, in addition to corticosteroids and immunosuppressants and the like, which are the frontline treatments in addition to a gluten-free diet, we have things that are used to treat secondary symptoms to celiac disease, like rashes. There is a pretty common rash that occurs as part of the immune response to gluten in the body of someone with celiac disease, and they have drugs to treat that, along with the fact that most people with celiac disease have vitamin or mineral deficiencies, and these nutritional deficiencies are usually treated with supplements. These medications are adjunct with your usual treatments, and all medications for celiac disease are adjunct with a gluten-free diet. Other treatments may be necessary, in certain circumstances, like very severe cases of celiac disease, people who develop complications secondary to celiac disease, and symptoms severe enough to interfere with everyday life. There are also treatments that have ongoing research in relation to celiac disease. They're starting to develop some, they call it immune modulating therapies, which are medications and therapies which aim to train the immune system to tolerate gluten so the body no longer attacks it. There's also some inhibitors that they're developing, which the goal is to protect the small intestine from damage that is caused by celiac disease, which is a large problem. And then they also are developing something called multi-specific antibodies, which aim to inhibit gluten-dependent T-cell activation, aka the immune response that occurs in celiac disease, and it would prevent ingesting gluten from damaging the intestinal tissues or damaging it as much as it would have otherwise. And there is also a lot of other research going on to find a bunch of other different therapies to help.
So some labs and diagnostic findings, there is 2 blood tests that can help diagnose celiac disease. One is serology testing, and it looks for antibodies in the blood. Elevated levels of the certain antibodies proteins indicate an immune reaction to gluten. Another one is called genetic testing for human leukocytes antigen, can be used to rule out celiac disease. If one of the tests become positive, further testing needs to be done in order to confirm a diagnosis to it. So there's 2 different types. It's called endoscopy or capsule endoscopy. Both are used for the same purpose. It is either a long tube with a tiny camera or a capsule you can swallow. Both cameras enable the provider to view the small intestines and take a small tissue sample called a biopsy, and with that it helps to analyze for damage to the vial.
So next we have our nursing interventions for celiac disease is lifelong diet with restrictions on wheat, barley, and rye. Oats are often avoided because they are routinely contaminated with wheat during growth and processing. One other thing to do for nursing interventions is assess patients from head to toe. Note that the classic profile of a child with malabsorption syndrome is an enlarged abdomen with atrophy of the buttocks. Another is it is a nursing challenge to teach the family the importance of dietary compliance because tiny amounts of gluten can damage the villi of the intestines. Monitor weight and nutritional intake daily, collaborate with dietitian for meal planning, and maintain clean and dry for skin integrity. So, as far for patient teaching, inform parents of maintaining a gluten-free diet because it can be challenging. As far as because of gluten, it is often expressed on labels as malt, and it is an emulsifier stable. It is in emulsifier stabilizers, meats, substances, and thickening agents in many processed foods, soups, and candy. So making sure that we teach the patients or the patient's parents about label reading skills. Another is to demonstrate meal planning techniques, so educate parents to feed children's foods rich in essential nutrients, many of which might be deficit in a child newly diagnosed with celiac disease. Restoring these nutrients to normal levels in the body are essential for your child's brain function, emotional regulation, learning abilities, physical growth, and development. And lastly, provide comprehensive disease education. This helps the patient and the parents to understand how to adhere to treatment plans and overall quality of life for the patient.
Complications. Some complications for celiac disease are malnutrition. What causes is gut can't absorb nutrients. Also anemia, low iron from a poor absorption, osteoporosis, lack of calcium and weakness of bones, infertility, hormones affected by low nutrients, and lactose intolerance, gut lining, and damage. Also, skin rash, immune skin reaction to gluten, cancer. It's a cancer risk, chronic gut damage increases risk, and liver issues, inflammation affects liver. In conclusion, celiac disease is a serious autoimmune condition triggered by gluten. Early diagnosis and strict gluten-free diet are key to preventing complications and improving quality of life. Untreated, it can lead to long-term health issues like malnutrition and bone loss. With proper management, most people can live a healthy, normal life.